Welcome, everyone, to part 3 of our What is a Medically Tailored Meal series, in which we are taking a deep dive into the food as medicine movement to give our audience a better understanding of medically tailored meals and their outcomes in our communities. In today's segment entitled Medically Tailored Meals in Action, we have the privilege of speaking with two individuals of the Minneapolis Veteran Affairs Healthcare System. It is my pleasure to introduce you to kidney specialist Dr. Yoav Segal and registered dietitian and certified specialist in renal nutrition, Olga Polyakov. Dr. Segal, Olga, thank you for joining us this afternoon. It's so great to have you. Why don't we start by each of you telling us a little bit about your role at the VA?
Olga, if it's okay with you, I'll go first. I'm one of the kidney specialists at the Minneapolis VA, and I happen to be the chief of the kidney section here at the Minneapolis VA.
I am registered dietitian at Minneapolis VA, and my specialty is renal.
Thank you both. I mean, it's so good to talk to you. This is going to be such an invaluable series for our audience, especially when we're talking with two specialists in this field. Especially it's a field that we treat at Open Arms in Minnesota. But we're going to talk in generalities today about medically tailored meals. I'd first like to start with your history with medically tailored meals. Like, what is your background? When did you remember first hearing about it? And kind of when did it come onto your scope or your radar? Maybe start with you, Dr. Segal.
So our knowledge of medically tailored meals has really been through Olga, primarily, or at least the operational aspects of those medically tailored meals. I will tell you ahead of any details on that she provides, that as physicians, as other types of providers, we can't imagine a more important cornerstone of treatment in patients with kidney disease, and specifically those who are on kidney dialysis. Those, I think, are going to be the focus of our patients today, or of our discussion today. But it's a cornerstone, and hence our not only openness but deep interest in being able to provide this service to our veterans. Also, in larger part, to what we hope would be high-level, even world-class care that we could provide to our veterans.
Gotcha. Thank you. How about you, Olga?
I have been at the VA for the last 23 years and always been providing medical nutrition therapy for veterans. Medically tailored meals have come about, I would say, 8-10 years ago, when a lot of different types of meal options came out. There are various programs out there like Meals on Wheels, Mom's Meals, Top Shelf, Open Arms. And I started looking into those meals and see if those meals would fit veterans' nutritional needs based on their kidney conditions and being on dialysis. So I would say last 8 to 10 years, I've been referring veterans to medically tailored meals.
Gotcha. That coincides perfectly with kind of the explosion of this food as medicine movement and medically tailored meals nationally. It's really interesting timing right there. So let's get specific with the world you all work in at the VA. Tell me, can you explain the specific dietary needs of patients with kidney disease?
So I'll start off, if that's okay. They're complex, and especially those who are on dialysis. Now, I can tell you that if we were in a small room, all of us, and I had a whiteboard or a piece of paper, I might draw some of this out. But if you can imagine, the human body, in order to function properly, really needs to maintain all manner of balances. Balance is very important in human body functioning. There are a lot of substances that, as they're taken in to meet needs of one kind or another, have to be eliminated in equal measure. So if you can imagine a box where arrows go in, arrows of equal measure have to go out. And it's probably the kidneys that sit foremost in that regulation system. So at a point where substances are coming in, and there are any number of such substances that we could discuss, and we will in a second, a patient who's on dialysis doesn't have full access to those outgoing arrows. So that poses immediate challenges to balance. And hopefully that makes sense even on an intuitive level. So now to come back to your question, what are the special requirements that they need, that they face? And I might give you a few specific examples. So we all take in sodium, and that's a familiar term, a familiar substance for people. You can imagine an individual who's taking in sodium, but without working kidneys is going to be faced with the problem of eliminating sodium. That individual is in a position then to accumulate sodium. That's, by the way, where dialysis comes in. Where nutritional therapy is an obvious cornerstone is in modulating what goes in order to minimize the challenge of what comes out. So a patient who's on dialysis or a veteran who's on dialysis can't necessarily take in as much sodium as someone who has normally working kidneys. Otherwise, that sodium will accumulate. So one purpose of nutrition or of a diet that's adapted for a patient on dialysis is to reduce sodium, or low sodium diet, which will be a familiar term to many of your listeners. Same for even water. So there's a tendency to accumulate fluid between dialysis treatments. And medical nutritional therapy, one of its major goals in dialysis patients is to reduce the amount of those substances that would otherwise create imbalances. So I would say that there are three aspects in the answer to the question that you raised. One is managing sodium and water. Those two happen to be particularly important. And that's in ensuring that patients don't accumulate fluid between treatments. The other is in all manner of other substances. Most of them are minerals, and their names aren't necessarily important, but for the purpose of illustration, potassium and phosphorus. That might be the second element of medical nutritional therapy in dialysis patients. And the third, which actually might be the most important of all, at a point where there can be such an emphasis on restricting or modulating what's going in, and we sometimes send those messages to our patients, even if it's inadvertent, the most significant risk that can actually arise is that of malnutrition. So don't eat this, don't eat that. A lot of these patients suffer health challenges to begin with, and lo and behold, before you know it, they're malnourished. So another major objective of medical nutritional therapy is to ensure that in the face of all these potential restrictions, patients are actually well nourished.
Wow, that is so important. That leads into my next kind of question, probably more right up.
Olga may want to add something to that.
Yeah, unless you want to add something to that, Olga.
Yeah, I would agree with you, Dr. Segal, that creating a delicate balance and not excessive amounts and yet account for the risk of malnutrition is very essential. And that's where that medical nutrition therapy and counseling comes into play. And another thing too is veterans who go to dialysis they also have other medical conditions, and most of those conditions could be associated with high blood pressure and diabetes. So for patients who have diabetes, now we have to also account how do we plan those meals considering blood sugar. So that's another layer that comes into play. And our population at Minneapolis VA hospital is quite complex, and veterans do experience other problems. Some of them have wounds, some of them have swallowing problems. So it's a careful nutritional assessment and counseling, education, and services that we provide to make sure veterans receive the best care that they can.
That balance is so critical to that your specific clientele, right, or your patients. That's so interesting that we have a kidney issue that we have to treat, but then we also have other issues that we have to create that balance. That is so. I would have never taken that leap. So tell me, what are the roles in, or what role do medically tailored meals play in this, or what is a medically tailored diet, or how does a medically tailored diet address these needs? We kind of touched on it. You touched on it a little bit there, Olga, but maybe go a little deeper dive into that.
So medically tailored meals, they are reflective of appropriate dietary therapy according to evidence-based nutrition practice and guidelines to address those medical diagnoses, symptoms, allergies, their swallowing, chewing difficulties, just to ensure the best nutrition outcome. So it's a combination of medical nutrition therapy assessment, education, and services that are available to treat medical condition for dialysis patients. And medically tailored meals also can encompass nutritional supplements that we have available at Minneapolis VA that I assess each veteran and provide those supplements for veterans to assure that they are well nourished, and those supplements are very specific to dialysis needs to make sure they get the right balance, the right nutrients, right minerals without exceeding certain amounts that is not recommended.
Awesome. Thank you. So a medically tailored menu, for example, a kidney-friendly or renal menu, is usually tailored to clients on hemodialysis. These meals are typically high in protein. They contain low or moderate amounts of potassium and phosphorus. Dr. Segal, you just mentioned those two things, and then sodium to add the third right there. Why is that so important to one of your patients?
So there are two aspects to that. One, I would say, is in achieving nutrition goals. And there, the meals are in lockstep with a lot of the considerations that we laid out. And you happen to mention potassium and phosphorus, and those are two that we keep an eye on, all while ensuring that patients have the best chance of remaining well nourished. Then I would say that there's the practical aspect. This is a lot. This is a lot. It's a lot in terms of patients having to face a very serious chronic disease. It's a lot in terms of having to absorb nutritional guidance. Olga's amazing, but I will tell you that sometimes our patients get inconsistent dietary advice or nutritional advice. They are avid consumers of information. So sometimes there is inconsistent advice that emanates from other sources. And then to try to have a coherent picture of what this all means and to translate that into eating every day, can you imagine the challenge of something like that? And so from a practical standpoint, the availability of medically tailored meals just removes several layers of complexity from what it means to live with this otherwise very challenging condition. So we would hope that our veterans would have the opportunities and are grateful for opportunities that our veterans have to take full advantage of situations like this where their health is not only served, but maybe so is their peace of mind.
Sure. That leads me to a question. I'm going to skip one because you kind of had a good lead there, Dr. Segal. One of the components of home delivered medically tailored meals and a great program is how they can alleviate added stress, meal planning, meal prep, shopping, makes it easier for families to enjoy meals together. With that in mind, you kind of touched on it right now, but what impact do you see medically tailored meals making in patients' lives, and their overall, happiness, maybe even in the lives of their caregivers or their families? I don't know, Olga, if you work with patients, if you want to answer that, but I'm curious the outcomes you see just from a simple like meal prep and a practical standpoint.
Yeah, as Dr. Segal alluded that these patients are quite complex and sometimes it's too much to grasp just getting nutrition advice. So those medically tailored meals, they don't have to think about. The already meals are provided for them that are well balanced with all the nutrients that they need to nourish their body. So they could spend time with their family members, enjoying the meals, enjoying the holidays, instead of cooking and doing prep, instead of going to the grocery shop. And so that frees up their time to spend quality time with the loved ones, which is very essential. The other thing I wanted to point it out is many of veterans face food insecurity to begin with. And food insecurity is they're not able to afford meals. They're not able to afford nutritious meals, let alone trying to find the meals that would fit all their medical conditions. They're tired after dialysis. They don't have energy. They don't have cooking skills, and they may not be motivated. So this medically tailored meals already provide this service to make sure that they're well nourished so that they can get all the nutrients they need to make sure that they go on with their life and feel well and get that energy back, because that's very important in order to continue with their treatment, to make sure that they're well nourished.
I mean, I would just maybe add a little bit from my own experience taking care of veterans who are on dialysis. In my own such population of patients, I just happen to have a large percentage who live alone. And that's an entire dynamic unto itself, many of whom are widowed. And it just brings a tremendous amount of comfort to them to know that they can be contributing to their own health in a positive way, and at the same time removing the stresses of dealing with it themselves, varying in cooking skills in some cases, etc. I'll also tell you, our veterans on dialysis take a very intelligent approach to how they utilize medically tailored meals. So, for example, I met with one yesterday who happens to live alone and who has devised very sophisticated strategies for how he uses medically tailored meals as the cornerstone of this day and that day, coupled with this and coupled with that. So it enriches options in ways that are immeasurable. And so the veterans really are grateful for the opportunity.
Yeah, it's so interesting. Olga touched on the fact that, we don't like to talk about it, but nutritious meals are not cheap, right? And there is often a barrier there. And then you combine that with what you just said, Dr. Segal, about giving individuals the tools to provide comfort for
Yeah.
themselves, and then just really embracing that knowledge. That's so cool to see in the outcomes of this. So tell me, so at the VA, how can patients and their families get involved in ensuring that medically tailored meals are effectively integrated into their treatment plans? You just kind of touched on it a little bit there with one example, but maybe others that you've seen maybe on a family level or in a home outside of just one person living there.
Yeah, I can tackle that one. So medically tailored meals, not only they provide meals for veterans, but for their family members as well. So some medically tailored meals can the other family members get services as well. So up to 3 people can get
Mm,
meals, and then they all enjoy meals together.
that's awesome.
I'm not. If I could add anything to Olga's response, I don't know if I have a lot of insight as to how patients and families can initiate. But at least here at the VA, we're very thankful that we have someone like Olga, who's such an amazing advocate on their behalf, and takes the lead in almost all instances.
Gotcha.
When I
Gotcha.
go to dialysis, I see every dialysis patient every month. I offer different programs, medically tailored meals to veterans and get them involved. And if they're interested, trying different medical tailored meals, I complete applications with them in their families, and we get the process rolling. And we could always adjust the medically tailored meals if they need more services, if they need to increase number of meals. Sometimes the family members also struggle with the medical conditions, and I'm so grateful that medically tailored meals also are offered to family members as well, which is wonderful.
I'm curious, Olga, when you bring this up in those conversations, I'm sure it's new information for the majority of individuals. Is it kind of a light bulb moment for them? Is it like kind of
Yes.
mind blowing, or like I would love to be on a fly on the wall in those conversations. It'd be so fun.
Yes, veterans are very surprised, positively surprised that, wow, I could get those meals and for my family members, which is great service. And veterans deserve this service. They fought for us, and now we're here to provide the best care for them
Mm,
and be grateful what they have done. So that is a great service for them.
that's wonderful. Wonderful.
I,
Um,
I,
Go
I
ahead.
would just support that point very, very strongly. Our veterans deserve the best, just as Olga said, and we're glad that this is representative of that.
Gotcha. So tell me, do you two, either of you, have any fun success stories that you'd like to share where a patient receiving medically tailored meals as a part of their treatment plan, how it made a difference in their kidney health, how it made a difference in their lives? Any success stories you want to brag about?
Yeah, I have a couple of different stories. The first one is I have a veteran who's been receiving medically tailored meals for last several years, being on dialysis, to the point where he learned what the balance means. By
Mm,
looking at those meals visually and consuming those meals, he realized, well, now I could take control over my own life and start preparing my own meals based on what I have learned. So not only nutrition sound advice, but physically being able to see what those meals look like really inspired him to take care of his own health. And right now, what he is doing is he is mimicking those medically tailored meals by going grocery shopping, buying those types of foods, and creating his own meals. So it's a teachable moment for a veteran to be able to do that. That's
Mm.
one of the stories. And the other story I have is it's more of a combined kind of effort. I've done quality improvement study here at Minneapolis VA 5 years ago, where veterans volunteered to be part of the project. So this was a quality improvement project, and I've looked at 15 veterans at the time that received medically tailored meals for 6 months. And I've looked at a couple of different things with those veterans. Number one is the quality of life. So there was a questionnaire that they voluntarily completed, and we've looked at the quality of life before they started medically tailored meals and 6 months after receiving those medically tailored meals. And we started seeing the improvement in the quality of life in general terms for those veterans, which is great to see that they
Mm.
perceived themselves that their quality of life has improved because of the services that were provided. And we started also seeing some improvement on the blood work results that we kind of talked previously, like that potassium and phosphorus. We started seeing some better levels associated with medically tailored meals. Of course, we need future studies, research, and projects to see the further what kind of things we need to look at. But preliminarily, this showed some positive outcome.
So wonderful. Two great examples. Thank you, Olga. How about you, Dr. Segal?
Um, do I have a story? I don't know if I have a story that's high level precision for a specific patient.
Mhm.
Maybe the story is my own, that I know when my patients are receiving medically tailored meals that the quality of their nutrition um, is going to change dramatically in most instances, along sometimes with the quality of their lives or their day to day.
Mm.
And what there may have been as a comparison will differ from case to case. So whether that's inadequate intake, which is often the case for veterans and other patients who are on dialysis, or maybe choices that aren't the best, that changes. And it's very reassuring to a provider to know that in this cornerstone of therapy, even if we're not perfect, we're doing the best we can. And that is reassuring, and it's a big piece of the therapeutic relationship.
I love the positive note to end there. Oh, that thank you so much, you two. This has been a wonderful conversation. So before we end here, for veterans watching this, how maybe they have kidney issues, maybe they don't, or maybe they're just curious about medically tailored meals and veteran affairs and the VA itself. How would they go about getting in contact with you all or with you, Olga, or what's the process look like there?
Well, the best thing how if they have kidney disease, they automatically see a registered dietitian, which is me at Minneapolis VA, and I bring those services to them. If they do not have kidney disease, they have other medical conditions. Typically, they get referred to nutrition services and to see a dietitian by providers put in place in the consult to meet with nutrition with the dietitian. And we have many registered dietitians in Minneapolis, VA, that would offer medically tailored meals to each veteran as an option.
Gotcha. Thank you. Well, thank you too. This kind of concludes our part 3 of our what is a medically tailored meal series. I want to thank you so much to Dr. Yoav Segal and our renal nutrition specialist, Olga Polyakov. I think I got that name okay, Olga. I did pretty good the whole time. I'm very proud of myself. I'm not going to lie. But both of these individuals work for the Minneapolis Veteran Affairs healthcare system, and I want to thank them so much for joining me. This is going to be, like I said, this is going to be a valuable tool to educate our audience on the landscape of food as medicine and medically tailored meals, and how it's working in practice, especially somewhere specific like the VA. So thank you too. Have a wonderful afternoon, and we'll be in touch as we come to you with part 4 next.
Thank you for the invitation.
Thank you so much.
All right, where's my recording?